Palliative care comes from kind of a rich history of trying to look at the whole patient and think about quality of life for the patient. We're not necessarily the oncologist taking care of cancer or the cardiologist taking care of heart failure, but we come alongside them, help to manage symptoms, and then look at the whole picture with a patient and have the conversation with them about what's important to them in their care. We tend to focus on patients who have more complex illness, more difficult symptoms to manage. My son had cancer, and understanding that there are conversations I remember with physicians that I will never forget the rest of my life. Javier Kane was a palliative care physician for my son, and I can recall the first time he walked into the room, he was one of the first physicians who actually sat down. He said, "Tell me about your son." What were his first words? What did he like to eat? He cared enough to get to know us a little bit. And I remember the very first day of medical school, during orientation, hearing this, that your patients don't care how much you know until they know that you care. And that was what Dr. Kane did for us that day. He cared enough to find out who our son was, made all the difference in the world. And I think that's so much of what I want to give back to patients and families, is just take a minute to get to know them a little bit. Who are you as a person? What matters to you? The more you know about them, the more you find yourself drawn into their story and you want to make a difference.